leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host, joined today by Samy Sidhom, a physician, leader, innovator, currently serving as the Associate Chair of Specialties and Chief of Pulmonary Medicine at Atrius Health, part of Optum. Samy also holds academic appointments as a lecturer in medicine at Harvard Medical School and assistant clinical professor of medicine at Tufts University School. With a deep focus on innovative management of chronic conditions, population health, value-based care, telehealth, and healthcare ventures, Samy has been at the forefront of advancing medical practice and healthcare delivery. He mentors aspiring entrepreneurs through participation in the MIT Sandbox Innovation Fund and has mentored at the MIT Hacking Medicine events. Prior to his tenure at Atrius, he played a pivotal role in developing pulmonary outpatient practices and services and served as Chief of Pulmonary Medicine at Holy Family Hospitals in Massachusetts, where he also co-founded the Center for Advanced Thoracic and Pulmonary Care. He has also contributed to public health policy and is a former member of the Board of Respiratory Care for the Commonwealth of Massachusetts. Samy, it's so good to see you again and have you with me today.
Thank you so much, Naji, and thank you for inviting me on this wonderful podcast.
Our very first chat delved immediately into AI and medicine. I remember this first time we talked together. But before we go there, I'd love to know more about your personal story and journey. What brought you to medicine and now becoming the leader you are?
Thank you. That's a long story, but I will try to be as brief as possible. It sounds more cliche, but it's been a lifelong dream to be a physician. And I was born and raised in Egypt. I grew up in Egypt until I was 14. And very early on, I would say maybe as early as 8 years old, I gravitated to medicine, probably because of my own personal hardship with a medical condition. And I was a patient for a very long period of time during my childhood. And I saw the difference a good clinician, physician can make in the life of a person and a family. And it inspired me to care for others and to have some type of or a degree of empathy that I share with people who I think we are all invariably become patients at one point or another. And it connects me to our humanity on a deeper level. And I felt that medicine really is my calling and something that did fit my aspiration and my personality. I kept my eye on that goal ever since then. And everything I did was towards leading to a career in that field.
Well, thanks, Samy, for sharing this. So really, as you said, we all can be patients. We all care for patients. Your story is so powerful, from being a patient, becoming a healthcare provider, and caring for patients on a daily basis. I would love to hear, as you've been also passionate about leadership, leading teams, treating them daily, practically in today, and being at the forefront of the pandemic. I think you're in one of those specialties that dealt a lot with COVID-19. We're over the pandemic somehow, but still, I'm sure you're dealing with peaks of COVID these days. What has been your biggest leadership learning through those times and through those years of experience as you grew as a leader?
I think this is a great question, and I think it's not just limited to the pandemic. It really is a journey of a clinician and a physician. It's a journey of adaptation and pivoting, and rolling with the punches and anticipating challenges and rising up to challenges that you could not anticipate. And having that kind of skill set and mindset of eventually things will work out. Eventually things will be overcome. Eventually things will be managed. So long as that there is a kind of a growth mindset that we're able to pull together from resources, from learning experiences, and from knowledge and from science to be able to adapt to a new challenge and a new environment. For me, getting to where I wanted to be has been a challenge. I think anyone who has gone through medical training and climbing up in terms of leadership in the healthcare field, this is just nothing but a journey of challenges and obstacles, whether it's through admissions and whether it's through completing training, whether it's through internships and residency and fellowships and research and grants and publications and applications that get through and things that get turned down and things that work out and changes that happen all the time. I think this really allowed us and allowed me to be able to deal with the challenges of COVID-19, despite the immense pressure and the immense problems that we faced during those years, especially early on. Being able to pivot, for example, into our practices and make changes necessary in the workforce, to go from almost no virtual medical practice to a full telemedicine platform, to dealing with the challenges of patients with long-haul COVID. And one of the things I may have mentioned to you in our conversations before, we had established a multidisciplinary long-haul COVID clinic at Atrius Health, where I work now. And that was dealt with a lot of the very complex and complicated long-haul COVID patients. And we ran that practice for quite some time until demand had waned. But this kind of journey and setbacks and overcoming challenges is not going to just stop at COVID. It will be for the next pandemic. And unfortunately, as history tells us, there will be more. But I think us as medical professionals, we are very well equipped with that mindset to be able to adapt and pivot. And this is something that I really feel that is very unique and valuable for leaders who with medical training and healthcare training. We can really go through some significant challenges and obstacles, but we are very resilient.
And Samy, I loved how you framed it on leadership, rising up to challenges you didn't even anticipate. And I think you're talking to that. So if I want to go more specifically about your journey, you came from Egypt, as you said, you had several challenges, you said, as you were getting into med school, growing in med school, and now leading a large organization and being an associate chair. What is the biggest challenge you felt as a person going through this, and any advice you would give a potential med student or someone who's looking to become a physician like you?
Thank you, and I like that question. I think it can be answered in many ways, and maybe I would have answered it differently in earlier years than in my latter years now in my career. My answer now would be finding a balance. Finding a balance where you can not just be a leader in the office or in the practice or for your coworkers, but also to be a leader among your peers and being a leader in your home environment. And I'm not talking in terms of leader being a tyrant or being a dictator, but just being that best person that the people around you want to look up to, look for guidance, depend on, rely on, collaborate with, share with, and be vulnerable with. And that spans not just the work environment, just having that balance at home with family, with children, with a spouse, with friends, with community, not just the office. And I think finding that balance as an aspiring physician or an aspiring healthcare professional is very difficult, because you get pulled in different directions. You have to reprioritize things frequently, but you have to always land on what your core values are and what you feel is important for you that cannot be negotiable. For example, for me, my family is a non-negotiable. They will always be priority. And I always have to look at them and look at their needs and their companionship and their support, because just as much as they rely on me, I rely on them. And there will always be there. There will always be different jobs. There will always be different careers. There will always be different schools and training and experiences. But the family is what holds my core together. And that's what I challenge any student, any trainee, any person going through the process, is to try to identify this core value and to make sure that that stays sacred and protected, and to be able to develop those leadership skills in different aspects, not just professionally.
That's such a great advice, Samy. Finding this harmony, this balance, as you're saying, is really key for us as humans, right? And several times, with many leaders I discussed, it's something we realize later on in our life and career. So as early as you just take it and embrace it and believe that those who are saying it like you is really true, I think would be super beneficial as we grow and develop our careers and our lives. If we look forward now, thinking really about innovation in healthcare, it's something you're passionate about. You touch us through your work. As we said, you work a lot with MIT Sandbox, startups, entrepreneurship. What are you most excited about when you look forward, and things that you think will really improve population health?
This is a very exciting time in medicine and in healthcare, and I'm really excited about this future. And I'm very lucky and fortunate to be able to see it from the lens of one of the most innovative places and academic places on the planet, at MIT, and also through the lens of one of the most population health and value-based care centered and patient-centric organizations, Atrius Health. As physicians, we're always looking for new tools. We are always looking for new tools. This has always been the driver for therapies and algorithms and quality measures. We're trying to find new tools and innovate with new things. And it sounds redundant, innovate with new things, but we're always looking for something new to use to improve patient care. And now we have this very amazing tools of machine learning, deep learning, and generative AI that promises to potentially continuously improve on processes that it had learned and continues to learn. And to be able to scale tasks and to be able to scale interventions, not necessarily interventions that AI is going to be suddenly doing surgeries or managing patients autonomously, but more so aiding clinicians to be able to deliver the care that they want to deliver with more efficiency, less burnout, and hopefully better therapeutic accuracy.
So if we double click on artificial intelligence and all the hype around it, is there a use case? I'm always kind of, because we used a buzzword, but I'm sure you, like me, when we discuss, it's all about the use cases. Like, how are you actually using AI to improve something very specific? So you talked about processes, but is there a use case that you're really excited about, or you implemented within your groups, or you're looking in a startup that is trying to do it to help improve patient care?
Yes, one of the things that we are actually looking at right now and hoping to pilot soon, and this is through work from Optum, is documentation for physicians and in the electronic medical record. And I've been previously exposed to an earlier version of that through our collaboration at Atrius with IBM Watson, where there was some effort to be able to summarize clinical cases and generate some evidence-based recommendations for management of patients with certain chronic conditions through learning the patient's chart and record. But currently, we're looking into documentation to improve physician workflow and reduce documentation burden and burnout, which is a significant problem for physicians. This is just a very simple and very benign case scenario. In terms of generative AI and language models, I think a lot similar to many practitioners nowadays, we are leveraging generative AI to be able to compose messages and emails and communications without, of course, disclosing any private information for patients. Composing emails, composing messages, composing certain algorithms. Those have been very useful, and I think that's not just for medicine. This is just more of a business office case use. In terms of entrepreneurship and startups, there are certainly, we've seen an implosion of many different startups using AI techniques and methods, whether it's from learning certain patterns about patients' conditions and suggesting treatments, for example, learning about patients' vital signs and use of certain medications and pattern of using inhalers to predict exacerbations of chronic lung conditions like asthma and COPD. I've certainly come across a number of startups in that space. And in addition to that, there's also the models for physical rehab, for example, and patients analyzing patients' movements and analyzing their posture to predict falls or to improve their physical conditioning and gait, and so on and so forth. There is numerous case uses, and I think it will take us much more than this podcast to go through. Fortunately, actually, I'll be hosting a panel of healthcare leaders shortly at MIT. Is through the Sloan Healthcare and Bioinnovation Conference, and we'll be discussing exactly those cases and similar scenarios and the outlook and the vision for different leaders in the industry, from care delivery leaders to tech companies such as Amazon Health Sciences. And that will be coming up soon in a couple of weeks.
That's great. And we're partners of, as you know, of the healthcare conference as SpreadLove and organizations. So we'll certainly talk more about it with you and the panelists. As you talk about MIT, I feel it's a big part of your story, your life. It certainly is for me too. You are graduating soon, so congrats in advance. I would love to hear from you your key takeaways as a physician going through the program from a leadership lens.
Thank you. Yes, we've sat through the same classes, and you're ahead of me in the game. So I will be rehashing what you've learned. But MIT has kind of taken on a life of its own for me now. The last 2 years have been transformational. I look at things very differently nowadays, and I owe that to the recalibration that we've gone through over the past many months, or the past couple of years. I see things in a different lens, and I apply the operation processes lenses, culturally, politically,
Oh yeah.
as well. So everything is looked at with a different discernment and different eye, different vision, and I look things a lot more deeper than just superficially. Just a normal trip to the grocery stores is different now. Looking at the pricing and the shelving and the
Oh, yeah.
workflow.
Don't tell me you do also like all the flow once you get on the payments and
Exactly, and looking to
trying to
see.
calculate the lambdas, and I love it.
Um, so, but from a physician perspective, it did open up my eyes to the fact that, we as physicians, it's not just about patient care, like in terms of prescribing medication X for condition Y. It's more about there's a bigger picture, and this picture, I'm glad to learn it because I'm so keen and interested in population health management and value-based care, meaning giving the most valued and highest quality care, not at an exorbitant cost to the patients and to the healthcare system, but reasonable. And that's through efficiency, through knowing what to prioritize, what to implement, and how to manage populations, not just one person. And I think we were very narrow, as a lot of my physician colleagues in the program, we enter very narrow-minded as physicians. But we graduate this program as innovators, as people who can see a bigger picture, people who can involve so many different facets of management into healthcare. And in that way, I feel like this is just going to be such a tremendous tool for improvement of healthcare in this country. The business, the goal of obtaining an MBA after an MD should not just be because of making more money or getting higher positions and glamour, or improving the bottom line, but it's more so to really improve the care for patients. Because the care for patients, it's not just clinical knowledge. And we have to really understand that that's the case. And this is something I encourage many of my physician colleagues to consider, and that it's not just the microcosm of science. It's healthcare lives within a bigger ecosystem.
Certainly, this system dynamic approach for us to be able to improve healthcare globally and increase our impact as leaders in the health industry. I would love now for you to give me your first thought when I give you a word. And the first one is leadership.
Servant leadership. Leadership is being a servant leader, is for me is that word service comes before leadership. And because leaders are elected or chosen or rise to the top to serve a purpose and to serve a population and to serve others. Otherwise, in my opinion, there's no need for leadership.
What about value-based care?
Inclusivity. And you have to be inclusive to provide high value. And I'm not talking about just socioeconomic. I'm talking about orphan conditions. It's just as important as common conditions. Being able to afford quality care. Everybody should be able to be afforded high quality care. The care that you receive should not be based on your color of your skin, where you come from, what zip code you're at, what your title at work is, who pays your rent. It should be based on you as a human. And that's the common denominator.
The third word is entrepreneurship.
I was just reading it the other day that entrepreneurship is an act of rebellion. And
I love it.
yes, and you basically are driven out of necessity or out of the dissatisfaction with the status quo to innovate and to create a new product, and to be able to get that product off the ground and make it successful and afford it to people who need it.
And the last one is spread love in organizations.
With transparency and honesty. And I think this is one criticism I had once from a colleague is that I lead with my heart. And I took it as a compliment, actually. Initially, it bugged me, but eventually it became more of a calling and more of a rallying cry. Yes, I will lead with my heart, and I would lead with empathy and with transparency and with honesty, because that's what the world needs. We don't need behind closed door deals. We don't need bait and switch in leadership. We don't need deception and lip service. And if we follow that concept of servant leadership, we really have to serve the people that we are with. And the people that we serve, we cannot serve without honesty. We cannot serve without transparency. Yes, of course, organizational secrets and trade secrets and intellectual property are important. And it's not what I'm talking about. I'm talking more about having a mission that's clear and apparent and transparent, having intentions that are transparent, having goals that are clear, and delivering it with all honesty. And I think that's when you have buy-in. That's when you have people believing in your mission and their mission, and will enable you to become a leader, an effective leader.
This is so powerful, Samy. What you said is powerful. You said, I will lead with my heart, transparently and honestly. I might borrow this from you. I love it.
Thank you.
Any final word of wisdom for healthcare leaders around the world?
We need more leaders. And I know this has been somewhat controversial in healthcare, as many people are looking into administrative positions and less clinical positions. But at the same time, it's really important that each physician and healthcare person is a leader, even on their own small scale. And leadership, as I mentioned earlier, my view on it is a servant leadership. And I don't need to have 50 or 100 or 1,000 people directly reporting to me to become a leader. I can be a leader within my own patient panel and my own small office. But we need better leaders who are able to cross cultural and ideological and political barriers. Because when we are guarded in our own little ecosystems, then we don't have growth, we don't have collaboration, we don't have this cross-fertilization. And my calling would be to be able to have many of us that are able to become more of the dominant population of leaders, are the leaders who are able to collaborate and be able to cross barriers. Because unfortunately, many leaders rise up to the top, but don't have that view and don't have that spreading love with leadership view. It's more of a very hierarchical and more of a power view of leadership. And I challenge everyone really to be transparent, to be honest, to be inclusive, to have empathy, to have compassion, and to be a servant leader.
Those are great words of wisdom for all of us. You said something that is really powerful, especially during these days. I think it has always been, but in days where we're seeing more and more polarization, more and more, unfortunately, hate more than love, having leaders, as you said, who can overcome cultural, political thought, personal beliefs, and barriers for us to be able to collaborate and make the world a better place is so crucial. Thank you so much, Samy. I know you're doing it on a daily basis, impacting several patients and impacting your organization and beyond. So thank you for all that you're doing and for being with me today.
Thank you so much, Naji. I greatly enjoyed our conversation, and I've been really looking forward to be here. And your questions are insightful and wonderful, and they did not disappoint. And thank you. I look forward to hearing more episodes with you and other wonderful guests.
Thank you all for listening to Spread Love in Organizations podcast. Subscribe and connect with us on SpreadLoveIO.com or wherever you listen to podcasts. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.